Blood glucose is the concentration of glucose in the blood. It comes from the food we eat and is the source of energy for our body and especially our brain. Maintaining glucose levels close to the normal range is an important part of keeping the body functioning in optimal parameters. Since we mentioned blood glucose values, you should know that they depend on your age or possible diagnosis of diabetes. In most healthy adults, blood glucose levels should be between 72 to 108 mg per deciliter on an empty stomach and up to 140 mg per deciliter 2 hours after a meal. For people diagnosed with type 1 or type 2 diabetes, normal blood glucose limits are different. Specifically, before a meal it should be between 72 to 126 mg per deciliter. After a meal, however, it should be below 162 mg per deciliter for people with type 1 diabetes and below 153 mg per deciliter for people with type 2 diabetes. In children, blood glucose varies depending on age. While normal blood glucose levels for newborns to 5-year-olds are 100 to 200 mg per deciliter, normal blood glucose levels for children aged 5 to 11 are between 70 mg per deciliter at bedtime and 150 mg per deciliter after a meal or before bedtime. For children over 12 years of age, normal blood glucose levels are similar to those of adults. You can test your blood glucose very easily at home with a blood glucose meter. If you don't have a blood glucose meter, you can determine your serum glucose with a blood test. Blood glucose testing can be done by testing serum glucose on an unsteady blood glucose after a period of 8 hours. This type of test is recommended especially in the case of diabetes diagnosis. Another way of testing blood glucose is post-meal glucose testing. That is, after eating a meal containing a certain amount of carbohydrates. This type of testing shows how tolerant your body is to glucose. In some cases your doctor may recommend a random blood glucose test at any time of the day. This type of test is useful in diagnosing type 1 diabetes. If your doctor suspects that you have glucose intolerance, type 2 diabetes, he or she will recommend that you have an oral glucose tolerance test. The test involves swallowing a dose of glucose, a syrup, and a blood test 2 hours after oral glucose administration. Because too much glucose in the blood can be harmful to the functioning of the whole body, it is important to monitor your blood glucose annually. The use of adjuvant supplements to keep blood glucose levels within normal limits can be an effective solution in maintaining normal glucose levels as part of a healthy lifestyle. Don't forget that along with blood glucose testing, it is very important to measure hemoglobin values. Take care of yourself.